Hi, my name is Lucy Musson and I am the Public Involvement Lead for the Research Design Service in Yorkshire and Humber, and I'm based in Sheffield. And I'm joined today by my colleague Holly, who is also a Public Involvement Advisor. And our role is to advise researchers on how to involve members of the public throughout their research. Today we're going to give you an introduction to public involvement and also talk a little bit about how the Research Design Service can support you.
Hi, I'm Holly Schofield, and as Lucy explained, I'm a Public Involvement Advisor for the Yorkshire and Humber region of the Research Design Service, and I'm based in the Clinical Trials Research Unit at the University of Leeds. First, I'm going to talk about understanding what public involvement is. The National Institute for Health Research, NIHR, definition of public involvement is research being carried out with or by members of the public rather than to, about or for them. So this means working in partnership with patients and members of the public to plan, manage, design and carry out So what do we mean by the public? The definition of public in each project will depend on the topic area. Researchers should seek to involve people with relevant experience and expertise for their particular research area. The public could include patients or potential patients. For example, patients with a specific condition for a clinical trial where treatments are being compared. It could be people who use health or social services, maybe a primary care setting, sexual health, users of parks, public transport, pharmacies. It could be carers. Carers are closely involved in patient care and have valuable knowledge and insight about their experiences on a day-to-day basis. It could be disabled people. Disabled people experience poorer health, greater incidence of chronic conditions than people without disabilities, therefore are an important group to consider. It could be members of the public who are potential recipients of health promotion programs, and this could be delivered in a variety of different settings, perhaps schools or children's centres, could be a weight loss or exercise program. Or it could be organisations that represent people who use services, perhaps a disease association or a charity that will have particular insight and knowledge around a specific disease group. Why is public involvement important? Patient and members of the public have that experiential knowledge that can have a real positive impact on research, such as ensuring its relevance. And Lucy's going to talk more about this later when she gives some examples of public involvement. So there's an impact on the research. There are UK standards for public involvement. They're basically a framework for what good public involvement in research looks like and are adaptable to different situations. They're designed to encourage reflection and learning, including where lessons have been learned when public involvement has perhaps failed to lead to expected outcomes. A tool to help people and
So now I'm going to spend a few minutes talking about the input that members of the public may have in research. So public involvement can be included at any stage of the research cycle. When thinking about where to involve members of the public in your own research, it's important to think about which aspects of your study would benefit most from having a public perspective. For example, this could be really early on when identifying and prioritising research topics. It could be when designing the study, it could be when carrying out the research, or maybe towards the end when analysing and disseminating the findings. I'll give you a few examples of how members of the public can be involved, but it's worth mentioning that public involvement may not be appropriate for every stage of the research project, and that is okay. The key thing is that the involvement you're doing must be meaningful, as this is what funding bodies will look for when reviewing grant applications. They want to see that the involvement is appropriate to your research and that it is not tokenistic. So what input might members of the public have? Really early on in the research cycle, members of the public can be involved in identifying research priorities, and this will help ensure that the research being done is patient-focused. For example, the Sheffield Motor Neuron Disorders Research Advisory Group identified the need to improve neck support and access to specialist care for people living with motor neuron disease. These ideas were developed into projects where a neck collar was developed to support neck weakness and a telehealth system was developed to allow remote monitoring of patients. In terms of commissioning, members of the public can be involved as co-applicants and help co-produce the project proposal, or they can help to refine the research question and review the funding application. So for example, they can review plain English summaries in order to help ensure that the summary is easy to understand and free from jargon. Public involvement can also be useful when it comes to designing the study. Members of the public can advise on appropriate methods to collect data and can ensure that research tools are worded appropriately. For example, involving young service users to provide public involvement during the design stage has been found to be helpful for ensuring that questionnaires and consent forms are worded in ways that are accessible to other young service users. Public involvement is also important for ensuring that prototypes, such as the neck collar I just mentioned for the head-up project, were appropriate for patients. As a result, the collar was made and has been well received by patients. Members of the public can be involved in managing the research by joining steering committees, and they can also be involved in undertaking the research as co-investigators. When it comes to recruitment and data collection, members of the public have a lot of input that can be very beneficial. that can advise on appropriate recruitment and retention strategies and ensure appropriate wording of research tools. For example, in a drug study relating to Alzheimer's disease, public involvement groups identified key issues which were discouraging people from participating in the research. One of which was that fatigue and time pressures for carers was a potential barrier. The groups provided ideas such as making research study visits a more positive experience for carers, and as a result of their input, recruitment rates increased. Members of the public have also been able to improve recruitment strategies by improving the terminology used in participant information sheets. Members of the public can also be involved in analysing data. So, for example, members of the public have been involved in analysing data from interview transcripts. This is useful for adding another layer of insight into interpretation, and they can also draw researchers' attention to what they think are the most relevant findings. Once data has been collected and analysed, members of the public can also be involved in dissemination and evaluation. They can disseminate research and advise on appropriate dissemination strategies. So in my project, which involved exploring people's experiences of public involvement, we found that members of a research advisory group helped with dissemination in a variety of ways, by engaging on social media, by presenting at conferences, and by talking about the research with people in the motor neuron disease community. This had a positive impact because they were able to translate the research into words that lay people can understand. They promoted the research, and they had access to patient networks to help to improve the credibility and accessibility of their findings, which has been shown in other studies as well. By endorsing the research, public involvement also has the potential to have a positive impact on future research, funding and policies. So I hope these examples have shown that public involvement can be done at all stages of the research process and that this can be very beneficial.